Hey everyone, welcome to Avaya University and our Overcoming Chronic Pain curriculum. I am Andy Anderson and my partner Ike Allen and I are the co-owners of Avaya. Thank you so much for joining us, for showing up for yourself for this really amazing series. In this next class, we are talking with fellow teacher Dr. Ronald Siegel, and he will be talking with us about mindfulness and rehabilitation, breaking free from chronic pain. Some of the really key points you're going to learn about are how Dr. Siegel finds that chronic pain is often not actually due to damage to the body or a disease process, but actually it is caused by something else. So we'll talk about that in depth. And he talks about how there is, in his experience, a lack of correlation between structural findings, let's say like different scans or MRIs, and actual pain, right? There can be a scan or an MRI done that shows absolutely nothing wrong and someone's spine or neck or what have you looks perfectly normal, and yet that person is having pain. So right, there's this disconnect, and he talks a lot about what he feels like that disconnect is in his experience. He talks about things like ACEs, adverse childhood experiences, and how people who have higher ACEs scores in their life, they experienced more childhood trauma, increases the chances of chronic pain. He also talked about another very common cause being stress as a whole. This stress could be due to your past and having trauma in your past. It could also be due to things like job dissatisfaction. How many people watching right now are in a job that you don't like, that you are dissatisfied with? Maybe you even hate your job. How is that affecting your physical body? So really just interesting things to take a look at as it relates to pain. He also talks about the importance of exploring how you react to sensations in your body, to feelings in your body. What kind of, once you are in pain, what kind of reactions do you have to it? What thoughts do you have when you're in pain? What beliefs do you have around it? What's your attitude around it? All those kinds of things. And then he shares a very personal story of when he was in a really horrible experience of chronic back pain, and how he was actually able to come up out of that experience and get over that pain. So he also talks a lot about mindfulness, what it is, how can it help you with chronic pain, how can you practice it in your life, what are the different things you can do to be more mindful. And he talks about mindfulness being an attitude toward experience. Ultimately, whatever's happening in your life, whatever's happening outside of you, how do you react to it? What's your attitude around it? And can you lovingly accept whatever is going on in your life? That being a practice of mindfulness. And also he dives really into exploring your emotional life. How are you feeling? What kinds of emotions are you having in your life? What kinds of emotions are you perhaps having but not being present to? Because so many of us want to push down emotions and bury them because we don't want to be present to them. And that also can have an effect on how we feel inside of our bodies and pain. So I hope that you will enjoy this next class with Dr. Ronald Siegel. And here we go. Thank you so much for being here with us today, Dr. Siegel.
Thank you for having me.
It's my pleasure, and I've known about you and your work for quite a few years. So I'm excited to actually get to talk to you about this really important topic of chronic pain. So let's dive right in. So first question, I know in your work you talk about how oftentimes chronic pain isn't actually due to the damage to the body or a disease process. So could you expand on that? So if that's not the case, then what does cause chronic pain?
Yeah, this comes as a surprise to, patients and doctors alike, actually, that a tremendous amount of chronic pain is not actually due to damage to some structure or disease process, but it's due to this complex, what we call a psychophysiological process. And let me say a few words about that. First of all, the experience of pain is something that happens in consciousness, in awareness. It's not possible to measure pain really outside of asking people, does it hurt, and how much does it hurt? So that's something that's happening in our nervous system, and it's happening in the brain. And as it turns out, the brain interprets signals coming from other parts of the body very, very differently, depending on its circumstance, depending on our beliefs, depending upon what produced the sensations in the first place. So that, to use the most common example around this with things like chronic back and neck pain, it turns out that the vast majority of people with chronic back and neck pain are not actually suffering from some disorder of the spine. That we've had study after study that has done MRIs up and down the spine of people with chronic back and neck pain, And it turns out that about 2/3 of people who have never had pain for more than 2 days in their whole life have a bulging or herniated disc. And many of you, our listeners, probably have been told that, if they've got chronic back or neck pain, oh, it must be due to a bulging or herniated disc. That's the most common diagnosis for that. You also have the findings that many people have surgery based on what we see on imaging, and the surgeon will repair the supposed abnormality of the spine that's causing the difficulty. The surgery is a success, the craftsmanship goes well, but the person is left with pain afterwards. In fact, there's a disorder called failed back syndrome, which is simply the experience of time after time going for a surgical intervention to fix something that shows up on imaging, and yet people don't have their pain resolved. Then we have the story that there are really millions of people who have chronic back and neck pain where you do imaging and the spine looks fine. It looks right out of the anatomy book. Everything looks perfect. But what's the explanation for that? So when we see this lack of correlation between structural findings and whether or not a person is in pain, we start to think, oh, okay, so pain is more complicated than that. And we start to ask, well, what are the other factors? It's interesting. The Boeing Corporation did a study many years ago. It was one of the seminal studies in this area, where they took thousands of employees and they examined everything about their work life, about their home life, about their psychological state, about what they did physically, how much exercise they got, how flexible they were, to try to figure out who would develop chronic back or neck pain in the coming years. And what they found was that the most robust variable, the thing that predicted it more than anything else, was, want to guess? It was job dissatisfaction, right?
Mm-hmm.
Had nothing to do with whether they were sitting or standing or bending. It was whether they were dissatisfied with their jobs. Well, that wouldn't make sense, right? If this was due to structural damage to the spine, but it might make a lot of sense if there were psychological factors that were playing a role. And then we see the international studies. It's things I'm sticking with back and neck pain because it's so clear in this area, but it applies to other areas too. You see the international studies in which it turns out that these disorders are very, very common in the developed world. In fact, they're epidemics here, but they're very unusual in the developing world. In fact, the WHO did a study many years ago. They found that the lowest incidence of chronic neck and back pain was in Nigeria, and it was the poor rural farmers who had the lowest incidence still. And these are people who do backbreaking work. They certainly don't sleep on, top of the line, Posturepedic. No, Posturepedic may be fine, but top of the line, special mattresses. They're sleeping on straw and doing backbreaking work, and they're bouncing on pickup trucks to get to the fields every day. These are the people without the pain, and we, with all of our ergonomic workstations, are dropping like flies. Something is going on here that's not about structural damage. Mm-hmm. And then we start to see that there are studies that show, I'll stick with back and neck pain for a moment, that having difficulties in childhood, having what's called high childhood ACE scores, which are adverse childhood events, basically having parents who divorce, having an alcoholic parent, having suffered physical or sexual abuse, having in some way not had a warm, loving, supportive environment as a kid, that predisposes people to these disorders. Well, that certainly doesn't make sense if it's due to these structural findings. So we see there's all sorts of evidence pointing in this direction. And basically what it points to as the cause very often is some form of stress, and particularly something that raises our anxiety level. Mm-hmm. And we can talk about the many things that do that and the various mechanisms by which this happens as we go forward.
Yeah, let's dive into that. So yes, stress, a word that I think everyone can relate to, right? We can all relate to this topic of stress. So what kinds of things create that stress and specifically the anxiety that could lead to chronic pain?
Right. Well, it can be absolutely anything. It can certainly be tensions at work, like job dissatisfaction. It can be difficulties in our home or family life. It can be feelings that we've had for a long time that we've never fully addressed, maybe left over from, past hurts or past difficulties in our lives. And what's interesting, what unites these things is whenever we're experiencing stress, which usually means experiencing fear in some way or tension in some way. Well, what happens? When we're physically tense, our body gets like this, right? We know this, and we intuitively know that this can cause pain. When somebody's had a hard day, a friend will come over and, massage their shoulders, because we just know that we carry it in this kind of way. And we also know that when muscles get super tight, like if you have a Charlie horse in your calf, that hurts tremendously. Even though there's no structural damage, none of us think, oh my God, I've torn my calf muscle when we get a Charlie horse. We think, all right, it went into spasm in some way. Well, a great deal of the kind of chronic pain we get is actually due to the constriction of muscles, to the fact that tight muscles hurt. And many of us are so chronically stressed that we're always holding this tension, and we're creating these patterns of pain. And there's a second part to it, which is really quite interesting, which has to do, I'll tell you the story where this was first discovered. This was first discovered by a fellow named Henry Beecher, who was a surgeon during World War II. And he was in the army, and he was noticing that a lot of times when he was helping to evacuate soldiers off of the battlefield who were in bad shape, I mean, they had serious injuries, but they weren't in shock. They were awake and they were conscious. They were not complaining of pain a lot. In fact, they weren't asking for morphine so much. And then a few years later, he gets into civilian practice, and he's doing surgeries where, clean incisions, nicely sewn up, and people are in terrible pain, and they're really suffering and asking for painkillers. He said, now what's going on there? And he came to the conclusion, and there's a lot of science subsequently to support this, that people were so relieved to be carried off the battlefield that it was like the brain simply wasn't attuning to the sensations coming from the arm or the leg or where whatever the injured part was. That was less relevant to the brain than the fact that I'm getting off the battlefield. Years later, pain psychologists started doing studies of what are the factors that produce pain. And the classic way they study this is with something called the cold pressor test. And that's basically, if you can imagine a bucket of ice water, and you ask the subject to insert their hand in that bucket, and it turns out that that's a way to inflict pain without doing damage, so you're not going to get sued or hurt anybody. And if you set up the experiment in two different ways, you get very different results. If what you say to people is, I'd like you to keep your hand in the ice water, and I'm going to ask you to keep it there for a minute, and you ask them after, let's say, 20 seconds to rate their pain level, they'll say, not bad, maybe a 1 or 2 on a scale of 10. If you set up the experiment identically, but you tell the person that they're going to have to keep their hand in there for 10 minutes, and you ask them after 20 seconds, they'll say, this is getting pretty cold. There's already a 3 or 4. I'm not doing this for 10 minutes, right? So what's the difference? Same sensations coming to the peripheral nervous system, but very different interpretations, right? In the first one, it's like, no big deal. It's only going to last a little while. In the second one, this could last a long time. So what happens is the brain fear actually amplifies the sensations happening in the body. And I've seen this over and over in folks that I work with, because we become very afraid of chronic pain. So why do we become afraid of it? First of all, most of us fear disability, right? The thought that, what if this doesn't get better? I won't be able to take care of my kids. I won't be able to work. I won't be able to do the things that I enjoy. My life's going to be ruined by this. That thought, which is completely natural, and virtually everybody with chronic pain has such thoughts, ups our level of fear and stress. That level of fear and stress does two things: tightens muscles, which tends to exacerbate pain sensations, and it heightens our sensitivity to whatever pain sensations are there. So you could easily see how this vicious cycle gets set up, in which we experience pain, and that could start from an injury, an overuse injury, a strain, a disease, all sorts of things. It could start just from emotional stress, but we experience pain, and we start to have the sensations. At a certain point, we start to worry about them, like, this is really going to upset my life. The worry causes us to tense up. Sometimes it's not just worry. Sometimes we get frustrated or angry. That also causes us to tense up. The tension increases the pain, and then we start to think, this is really getting bad. And you could see how that would create a cycle. And very often what happens, most of us, and this is true whether the pain is like back or neck pain that I was talking about, or pain from GI distress, or pain from other metabolic changes in the body, we tend to change our behavior in response to that. The person with back or neck pain, they stop lifting, they stop bending, often they stop working out, they stop doing yoga, they stop going to the gym because they don't want to exacerbate what they imagine is an injury. And then they lose their outlet for stress reduction and have all the more reason to be worried. And the muscles themselves actually get shorter and tighter and tenser and weaker. But let's say it's GI distress. We start to manage our diet, right? Well, I'll cut out tomatoes. I'll cut out spices. I won't eat fiber because it causes bloating or whatever.
Bad idea.
We start to make modifications in our lives, right? And the modifications in our lives both keep us riveted with our attention on the symptom. Is it getting better or worse? Is the modification working or not? And they also limit our capacity to engage fully in a meaningful way in our life. And so this really contributes to the cycle. And then almost everybody gets depressed. We get anxious when we're in chronic pain, and depression and anxiety contribute to it. So all of these factors can keep these cycles going. And frankly, I've seen people stuck in these cycles for a week, for a month, for a year, for a decade. In fact, I've done a lot of treatment with chronic back pain. Two of my patients, the ones who were stuck in this the longest, were stuck in it for 40 years, where they were really, really disabled, unable to do normal activities. Both of them went back to playing tennis, one in his 60s, one in her 70s. So these cycles can be very, very debilitating. We can get very trapped in them, and they can also be interrupted so people can become free and go back to their lives.
Well, that is the good news, right? So how about that interruption? Like, I'd love to talk about that. Obviously, people watching would love to hear what that's all about. And I know that it might tie into mindfulness because that's a big part of what you do. So could you chat about that and how mindfulness might be able to help people with that, breaking that cycle?
Absolutely. So a few words about mindfulness. So mindfulness is really this attitude toward experience. It's a way to approach whatever is happening in our consciousness with an attitude of awareness, of present experience, with loving acceptance. Okay. And that could be to turn our attention to a feeling of sadness or joy or love or fear with awareness. This is what's happening, and let me open to this and lovingly accept it. Now, that's not, of course, what we do habitually, right? Usually when we have fear, we say, oh, quick, how do I get it to stop? Or we have sadness, we go, oh, let me turn to a screen to distract myself, or let me fix it in some way, or let me have a success in life so I don't feel disappointed anymore. We try to get rid of these of unpleasant feelings and hold on to pleasant ones. And mindfulness is much more about cultivating this capacity to be with whatever is happening in the moment. Now, this attitude, which we usually cultivate through doing mindfulness meditation, and I'll suggest some resources for that in a little bit, and you can learn that following apps online. I have recordings on my website. Many people have offerings about how to learn mindfulness. So we do the mindfulness practices in order to develop this attitude toward experience. And then that becomes very relevant for working with pain sensations. There's a classic and really important study that was done some years ago that looked at both experienced meditators, people who had a lot of facility with mindfulness practices, and novices, people who didn't. And what they did was they put them in an fMRI, that's a functional MRI scanner, which basically allows you to do an MRI, which is an image of the brain in video form, so you can see it over time. And the feet were sticking out, so they used the feet as the place to induce pain, right? And they actually used a heat laser. And so both groups were exposed to pain. They got this laser that doesn't cause damage, but hurts a lot. And they looked at what was happening in their brain. And in the meditators, they found there was a lot of activity in this part of the brain called the insula. And brain regions all have multiple functions, but one function of the insula is interoception, to notice what's happening in the body, feeling sensations in the body. And that was quite active in the meditators. But the prefrontal cortex, the part of the brain that's involved in thinking, planning, evaluating, and stressing, frankly, come to the conclusion that this is bad, this is dangerous, how do I get to stop? That was relatively quiet in the meditators. In the non-meditators, the insula was more quiet. They were actually less tuned in to the moment-to-moment sensations of pain because they hadn't done so much practice of mindfulness, which tunes you into what's happening in the body. But the prefrontal lobes, the areas that involved in thinking and evaluating and reacting, those were super active. That's the, oh my God, I hate this. Ow, that hurts. Uh-oh, when's the next shock, the next, pain going to come? And then they asked both groups to rate their experience. And fascinatingly, the meditator said, the pain wasn't too bad. I forget the numbers, but maybe a 2 or 3 on the scale of 10. And the non-meditators, much worse, like, 5 or 6. That was pretty intense. So what we see is when we do practices that help us to turn toward experience and try to relax into it and accept moment-to-moment sensations as they arise, what happens is we actually feel the sensations more. And this is tricky with chronic pain because when we take up mindfulness practice, at first it hurts more. But then when we stop resisting it, when we stop fighting it, and when we learn how to disengage from all the worried, angry, frustrated thoughts about the pain, then the suffering drops and people are able to be with it in a much better way. And this is going to be important because to get out of these cycles requires 2 things. It requires changing our relationship to the pain, learning how to relax into it and open to it rather than tense against it and fight it on the one hand. And the second thing that it requires is the courage to live our life normally. The first step in this always is, to get a good medical diagnosis and get a trusted healthcare professional to give you permission to live your life normally. If it's neck or back pain, it's about, doctor, will I damage myself if I start going back to the gym, if I go back to jogging, if I go back to whatever, physical activity I've given up because I was afraid of it, because I didn't want to exacerbate my injury. Once you get permission to do that, then you can incrementally build back up the capacity to do that. If it's a GI problem, the question becomes, ask the gastroenterologist or your primary care doc, will I cause irreparable damage to my gastrointestinal system if I start eating a normal, healthy, balanced diet? Are these things dangerous to me? And indeed, if somebody has celiac disease, yes, you can't eat gluten. If you have a peanut allergy, you can't eat peanuts. But a lot of what happens for many of us is we start to micromanage symptoms of gastritis or irritable bowel syndrome or bloating or gas by trying to figure out what foods did it and then eliminating those foods. And very often that just keeps us more and more preoccupied with the problem. So the first step is medical evaluation, rule out serious things that either need to be treated in a different way or that really mean you really do have to place limits on how you're living your life. And there are such disorders for sure. For the vast majority of people though, physicians can say, no, you're not going to damage yourself if you go back toward living a full and normal life. The second thing is to notice, okay, what have I given up? In what ways have I restricted my life because I've been afraid of exacerbating my condition? And then figuring out, okay, how could I in a systematic way bring this back into my life? How could I start exercising again? How could I start eating more normally again? How could I start exposing myself to the things in life that are meaningful and good for my overall health that I may have given up? And we can use mindfulness practice to help us with the symptoms when they come up, right? So that when we start to, have an aversion response and get all worried and get tense and resist it, instead of doing that, we can relax into it and just be with the sensations. And we start to notice with mindfulness practice, sensations come, they go. Even chronic pain fluctuates over time. It becomes like, instead of a solid thing, we start to see it more like frames in a movie changing over time. It makes it easier for us to manage it. We're more in the present. We're less caught in our thoughts about it, our fears about it. And then the last component of this is really taking a look at our emotional lives. So, okay, what's going on that might be causing emotional stress for me? Is it sadness that I'm having difficulty with? Is there anger that I'm having difficulty with? Are there conflicts with people in my life that I'm having difficulty with? And as it turns out, mindfulness practices are really helpful for working with emotional issues too, because they help us to not be so immediately reactive, but rather to be able to sit with the difficult feelings when they come up. understand them better, and notice the whole constellation of thoughts and feelings that are going on, basically to make things that might previously have been somewhat out of our awareness and not so present in consciousness, to make them more conscious. And very often when we start, if we can do all of these things, if we can get permission to engage more fully in our life, start engaging more fully in our life, and resuming the activities that we may have given up, having less fear around the whole thing, because we're learning how to be with these changing experiences, and then really attuning to what's going on emotionally. For the vast majority of folks, this really starts to shift chronic pain experiences. For some people, they go away because they're really just caused by these loops. For other people, okay, there may be a structural issue that's as part of it. Maybe there was an injury that's going to have where there'll be ongoing pain. But these other factors, these psychophysiological factors that can amplify it and make it so much stronger, so much worse, we can take care of those. And then it may be that whatever's left is quite manageable, rather than being so overwhelming. And in a given case, we never know, what percentage is due to, if you had a car accident and, really structures of the body really have been altered. Okay, some of that's going to persist, but these other elements, this pain, fear, tension, loop element, can make it a whole lot worse. And mindfulness practices plus moving to rehabilitate ourselves can really go a long way toward helping to resolve those.
That's awesome. It reminds me of a story, and I've shared this in one of the other classes in this series, that I had plantar fasciitis for years when I was a runner back in my 20s. And I mean, running was a huge passion of mine, and I ended up stopping running, and it took probably a couple of years to finally resolve it. But I really didn't realize it until I started talking to you and some other people about it, the process that I went through, because I was so meddling in the fear of it being there, and just my life was absorbed into, I have plantar fasciitis, I have this thing, it won't go away. I mean, it was just years of negative thoughts around it and beliefs around it that just perpetuated and cycled and all this stuff. And I eventually, I think about the mindfulness, it was just accepting it. I'm like, okay, this is something I have. Maybe it's not going to go away. And I just actually accepted it, and eventually it resolved. And it I think about that and I'm like, oh my God,
yeah, no, I got into treating these disorders as a patient. It was about 30 odd years ago. I spent 4.5 months flat on my back with a herniated disc diagnosis. And I was not a happy camper. In those days, physicians said, well, you've got to get off your feet. You don't even sit. You have to stay horizontal. The hope is that the disc will heal. If not, you're a candidate for surgery. And surgery was very iffy, Not that many people recovered from surgery. So I'm lying around feeling horrible. It's not getting better. I'm getting more and more tense, more and more anxious about this. I remember I thought there's got to be a more active approach. I went to see a sports medicine orthopedist, and he took one look at the CAT scan. They weren't using MRIs back then. He said, if you don't stay off your feet and stay in bed, you're going to be begging me for surgery in 6 months. That was easy to take. I was actually, lying around day after day. At a certain point, I thought I'm a psychologist, so I thought I have a fairly sedentary profession. So I actually had friends of mine construct basically a couch or a platform bed in my clinic office, in my private practice office. And I began this bizarre parody of the classical psychoanalytic scene. My patients were sitting up, I'm lying down, and they're worried about my prognosis and my pathology. What's going to happen to Dr. Siegel, right? And this goes on, month after month. I'm really miserable. My wife, who's also a psychologist, she made a really interesting observation. She said, you seem to complain more of the pain whenever we have an argument. And I thought, okay, this is my penance for marrying a fellow psychologist. Right. Here I have this clear orthopedic problem, and she's going to interpret it, where she's going to interpret it in the context of our relationship. But she was right, because every time I was more tense, the pain was worse, and I started realizing, well, that is true. When I get more upset, the pain's worse. And then ultimately there's this guy at work who said, you got to call Linda. Linda knows a lot about backs. And Linda was a clinical social worker. And I thought, what's she going to know that I'm in the Boston area and connected to Harvard Medical School? The Harvard doctors aren't going to know. But he kept insisting, so I called Linda. And Linda says, so what are you doing? I said, I'm lying down. That's all I ever do. I was a real peach during this
Yeah.
period. And she says, why don't you get up and buy groceries? Your wife will appreciate it. And I think, are you nuts? I can't buy groceries. I'm disabled. I can't do anything. She said, just do it. You'll feel better. And then she went on to basically present this idea, which in those days was very not widely known, but now is really much more accepted, which is that, what you see in imaging is very often coincidental to whether or not you're in pain. It's, it's simply not relevant. And what happens is these fear cycles can trap us in these disorders. And I actually had an appointment scheduled with a, Harvard Medical School surgeon who tops in the field. A few weeks from then, I waited actually months to get the appointment. And I thought, just before I go for the surgery consult, I'm going to risk this. I'm going to just try treating this as though maybe my mind and my fear really is playing a role in this. Mm-hmm. And I started risking moving. And at first, it hurt a bunch. In fact, at first, I had known from my experience that I could walk about a city block and then I'd get, sciatic pain shooting down my leg, which made sense. The disc is bulging, pressing on the nerve root. And I thought, okay, I'm gonna push this. And I walked my block, got my pain right on schedule. And then I thought, I'm gonna walk another block. And I walked another block, and to my utter surprise, I then developed additional pain shooting down the other leg. I had it in both legs. And at first I thought, oh my God, now I've shattered my spine entirely. That was dumb to follow Linda's advice. Mm-hmm. But after a little reflection, I thought, well, wait a minute. I'm not supposed to have pain down the other leg, because I knew from the radiology report that the disc was herniated laterally to one side, as they usually are. So I was supposed to have pain down one leg, but not the other leg. And I knew this well because I used to read the radiology report practically every night before bed. I was so obsessed. I was so upset by this disorder. So if I had pain down the other leg, well, what's happening here? So my first thought was, now I've shattered my spine entirely and it's all over. But my second thought was, maybe Linda's right. Maybe there's something else going on. And I just decided, before seeing the doctor, I'm going to start trying to go back to normal activity. And 2 weeks later, I was a lot better. Not entirely gone with the pain, but I was discovering, it doesn't make things worse, really, to re-engage in my life. And that gave me a sense of hope. And then I just moved on to rehabilitate myself and then walked out of the disorder. And it was really after going through that experience and then, maybe a year later thinking, I'm a psychologist. This was a shift in understanding and paying attention to both my psychological reactions and my behavior that really got me out of what looked like an intractable orthopedic disorder. Maybe I could help other people with this. And that's actually how I got into treating mind-body disorder. So yeah, there's nothing like personal experience to give us faith that, maybe there's another path here.
Right. Absolutely. So, you have this program, the BackSense program. Is that what you did? Linda and you develop that? Is that who?
No, it wasn't. Okay. I mean, Linda helped get it going by telling me to get out of bed and buy the groceries. But that I developed with some other colleagues, with a physiatrist and a mutual friend who was helpful at pulling it together into a book form. So there's a book called BackSense: A Revolutionary Approach to curing chronic back pain, which is, and I'm the first author, which is a step-by-step guide for getting out of chronic back and neck pain by following this process. And that includes both all of these elements. It includes starting with a medical evaluation to rule out treatable things. And you can have back pain because you have a kidney disease. I mean, there are all sorts of things. There are tumors, cancer of the spine. Rare, but you want to rule those things out first. Mm-hmm. Get permission to move normally. Systematically start to re-engage in your life. And the BackSense book sort of tells you how to look at your fears of re-engagement and look at the things that you've given up and how to get back into them. Learning mindfulness practice is that's taught in the BackSense program as well, so that you can work with the fears and work with the pain as it arises. And then finally, taking a look at our emotional life. What are the factors that might be contributing to stress and the like? Some people, interestingly, get out of these disorders just by understanding that, whatever is happening and physical findings may not be relevant to the disorder, and developing the courage to re-engage in their life and using mindfulness practices to work with the symptoms. Other folks find that they get their life back, but they have a bunch of residual pain, and then they want to use the practices to look at the emotional issues. So the Back Sense program and the Back Sense book are basically a guide to doing that. And while it's written for back and neck pain, it's really quite relevant for knee pain, for shoulder pain, for plantar fasciitis, for a lot of these other disorders. Once you can get a physician to say, it's okay, it's safe to start using your body again. I don't see anything that's going to break if you use it. And the question, by the way, for the physician is not, will this make me feel better or not? Because a lot of doctors will say, well, no, that'll make it hurt more. Don't do it. But the question is, will I damage myself? Because part of the getting free from these disorders is really shifting our attention from how do I get the pain to be less to how do I re-engage fully in life and no longer have any disability? The interesting thing is, once we re-engage fully in life, very often the pain will drop away. And yet most of us quite naturally go about this in the reverse order. We say, well, I got to get the pain to go away so that I can re-engage in my life. So that's becomes a very important take-home point. And when I work with patients around this kind of thing, a very important element of this is, how can we get you back engaged in a meaningful way in your life and change your relationship to these pain sensations? And then that interrupts the cycle. And once the cycle's the pain, fear, tension, avoidance cycle, and once the cycle's interrupted, then it's like, oh, wow, hey, the pain's kind of gone away.
Mm-hmm. Absolutely. So for people watching who want to dive into this approach of mindfulness and also might obviously be having to do some kind of rehabilitation and whatever that looks like for them, like, how do they get started doing this on their own? Or I mean, you recommend seeing a doctor to get that or permission to live your life normally again. And then beyond that, like, where do they go from there?
So beyond that, well, there are some resources. Other people have done this work too, but for example, the Back Sense book is one way to work with that. I also, I don't know if I should mention it here, but sure. I prepared a series. The organization that published it is called Sounds True, and it's an audio course on how to work your way out of chronic pain disorders, anxiety, other things like gastrointestinal distress, eczema, these kinds of disorders that can all be caused by the same kind of pattern. And that's called Healing Through Mindfulness. I think you're going to provide a link to that. So those are both resources that that people can use. And there are lots of resources for taking up mindfulness practices. One set is I've got on my website, which is mindfulness-solution.com. And there's a book called The Mindfulness Solution, which leads folks step by step through this. So I would say that those three resources would be one way to get started based on my experience with this and what I've learned doing these, working with patients over the years.
Awesome. So yes, and we will have buttons below. So there's a button to the course you talked about. We'll have a link over to your book. And then you also had a free gift, right? Like some kind of a lecture. Is that correct?
Yes. Yeah. It's called The Science of Mindfulness. It's actually a lecture that I did for Google some years ago. I love the engineers at Google. They're very actively engaged in mindfulness practice over there. And they say the goal of mindfulness is to develop higher resolution consciousness. More pixels per square centimeter of awareness, to really see more clearly what's happening in the heart and the mind and the body, and I would add, to develop this attitude of loving acceptance toward it becomes, is really critical for using it. So so the free gift is it's a little bit of a deal. If you share with me your email address, I'll give you a link to this Google Talk, which really focuses in on mindfulness practice in much more detail than we're able to do today. And don't worry, I won't sell your email to anybody, and you'll just hear about other programs and offerings that I'm doing.
Yeah, and not to mention like just being able to follow you in your work, because this is just a little tiny taste that we've gotten to dive into today, and I just have loved it so much, and I hope that everyone has gotten a lot out of it, and just amazing work. I love it. So, are any last insights? Anything else you want to leave people with before we wrap up?
Just that there's much more hope than many of us think when we're in the middle of one of these chronic pain disorders. Gosh, when I was in the midst of mine, I was so unhappy. I was so, and I was so despairing. I really thought, there's no way out of this. The doctors don't really have a solution, and nobody else does either. And just that, that's not necessarily so. I've just seen so many people that when we shift from treating these things as though they're just about injuries to really starting to think psychologically and change our behavior and notice how complex, notice that pain really is an event in the brain, and the way we relate to sensations has a huge impact on our life, that these things are actually workable. And I want folks who, I'm sure some of the folks who are listening are experiencing that kind of despair. And I want you to know that a lot of people have worked their way out of this, either entirely or at least gotten it to a level where it was no longer the main focus of life anymore. So you can go back to living a full and rich life.
Thank you. Oh, that just get me all teary up at the end there. That's awesome. Thank you so much for leaving everyone with that hope and inspiration that there is an answer to this. And thanks so much for all the work you do and for doing this with us today.
Thank you so much for having me and giving me the chance to share some of these understandings with your viewers.
Absolutely. And thank you everyone for tuning in, for showing up for yourself, for paying attention, for being mindful in this last class. And we will see you on the next one. Take care, everybody.